I'm Dr. Jennifer West, and we're going to be discussing seizures, how to recognize them, how to better understand them. So a seizure may be seen as an event where your pet has trembling, and it may be full body where they become very stiff, their legs may be extended, they may have a very rhythmic tremor, or even we call it bicycle circling their legs. And it's something where there's no way to really snap them out of it. They don't respond to you calling their name or petting them. They don't seem to be aware of anything. Their eyes are usually open. They may hypersalivate or basically drool a lot. Sometimes they're actually chomping at the air as if they're trying to bite something. And very commonly, they will void or lose control of urine and poop. They may just pass that where they're laying, and they may also vomit. Another classic thing we sometimes see with seizures is afterwards they're exhausted and they're still acting a bit off. They're not fully back to themselves. So anytime something like this happens, try to prevent them from being near anything that can injure them. So if they're on a high surface, kind of pat it. If you can, put pillows around them. Don't try to hold them down because they're not aware of what's going on. They may bite you. You just want to allow them to get through that episode and get them into a bed as soon as possible. The next big thing is if you're able, in the panic, honestly, it can be hard to do this, but if you're able to get a video of what's going on, even just a small clip, that can be tremendously helpful to make sure when you show your veterinarian that you get the right diagnosis, that it's truly a seizure that is going on. The reason you want to rush into your veterinarian is if an animal has a seizure, they very well may have another. And so things that your veterinarian are going to check for and possible causes for this happening. One, did they get into something? Did they get into the trash? There's certain toxins that can cause a seizure, or medications. Two, have they not eaten in a long time? Are they a young animal or just a very small animal that doesn't have good blood sugar stores? In the same regard, are they a diabetic? Are you giving insulin? Because unfortunately an insulin overdose or an inappropriate amount of insulin can cause an animal to go into a seizure. Three, any other metabolic or health issues that they're having. So unfortunately liver failure, kidney failure, different shifts in the body with enzymes could also cause seizure activity. Ultimately, if it's none of those causes, it may be idiopathic, which is just a term that we use to say when we do all the different diagnostics, there's nothing found. It's just called epilepsy. So they have a seizure condition where the electricity, the circuits to the brain, don't fire appropriately, and they have these seizure activity going forward. Other things could be a blood clot, like a stroke, or it could be an infection going on in the fluid coating the brain or spinal cord, or it could unfortunately be something like a mass or a tumor. So these are all things that of course need to be addressed to make sure that your pet doesn't have more seizures. As I said, sometimes you don't get a definitive answer as to what caused it, but you definitely want to go in to try to prevent more seizures from happening. Your pet may need to be started on medication to prevent them moving forward, and it's something that you need to be aware of, where if you have young kids in the house or an elderly person in the home who could be injured by the pet biting them, to definitely take precautions. Thanks so much.